This episode is sponsored by ODP Business Solutions, built to address all your facility needs. Visit odpbusiness.com today. When it comes to cleaning healthcare facilities, the stakes are higher and the standards are stricter. Unlike typical commercial spaces, healthcare environments demand specialized knowledge, strict adherence to protocols, and an unwavering commitment to infection prevention. Yet, not all cleaning companies are prepared or qualified to take on this critical responsibility. And that's our topic today with Iris Verde, a cleaning expert who knows what it takes to handle healthcare facilities. Iris, welcome to the program.
Thank you so much. I appreciate your having me.
Tell us a little bit about yourself. You're a first-time guest on Straight Talk. So, who is Iris?
So I am a 25-year healthcare veteran. I spent most of my career working in very large hospitals as an environmental services director and then as a facilities vice president. I was the customer. So I was the person who was outsourcing the cleaning of my clinics and some of my ancillary spaces, as well as some of my clinical spaces like a surgical center. So I think I have a unique perspective as having been the customer and then now as the contractor.
I like that. You are the expert, and that's what we want to get into today. So, yeah, you've seen both worlds and you've experienced it all. Well, I tell you what, let's do this. Let's start with a personal question. So, thinking about your experiences in medical and healthcare facilities, if you were to visit your own doctor or surgical center, heaven forbid if that were to happen, but it does, what would you be thinking about when it comes to cleaning and hygiene?
So it's interesting. We were just at a conference at your headquarters for the Healthcare Services Institute, and a conversation erupted among all of us about if you're going to having surgery in a hospital, do you want to be the first case of the day? And the reason for that is that we know that the cleaning at night is done better than the cleaning necessarily between cases. And when I've had two of my surgeries, one was in a hospital where I was in charge of environmental services, and I felt completely satisfied, happy, knew that I wasn't going to get sick. And then the second one was at a hospital where I had zero control and I was extremely nervous because I didn't know what the standards were for cleaning at that surgical center. And knock wood, I was fine. I had no surgical site infections, but being in this business, that's something that you consider who's cleaning that OR.
Being the first patient, that's interesting and maybe not controllable.
Yes, and I think that there needs to be regulations around that. Hospitals have very strict regulations when it comes to cleanliness and infection prevention, but when you're looking at an operating room specifically, the person who's handling your surgical tools and ensuring that those are disinfected appropriately has an accreditation and has to go to school. The person who's cleaning between cases and at the end of the day does not.
We need to fix that, Iris. That needs to be
Agreed.
fixed. Agreed. Okay. Yeah, I mean what you just shared with me, if I ever have to have surgery, I want to be the first one in, 4 in the
First
morning,
case, always
whatever.
ask.
But you know, what a shame to think that it gets a better cleaning at night when and it's the same importance between patients. So
100%.
yeah, thank you for sharing that. All right. Next point I want to get into is what you're seeing out there with companies who try to clean healthcare facilities, but really have no business doing it. What are you seeing from your perspective?
So I think that pre-COVID, you had a lot of smaller companies that were competing in the healthcare field. They were cleaning in office spaces and doctors' offices. And I think for the most part, people thought that was okay. I never did. I always wanted somebody who had that level of expertise. But in the last couple of years, I think that companies are underestimating the complexity of cleaning in healthcare. And it's not just about COVID, which is actually really easy to clean off of a surface. This winter, we had what I call a quademic. You had RSV, flu, COVID, and then norovirus rampant across the country. We're seeing measles and pertussis, two things that have been almost eradicated, reemerging in the last 2 years that are cleaned differently than your normal everyday disinfection. So even when a contractor comes in, if they want to approach something like commercial or residential cleaning, that's not the case. You can't just say, I'm making it look good. It has to be safe for the patients, for the visitors, and for the staff of that location.
As the modern workplace evolves, organizations must evolve as well. They need a partner that understands this new world of work. We are that partner. We are ODP Business Solutions, formerly Office Depot Business Solutions Division. More than just office supplies, ODP is a force for change, helping address technology transformation, sustainability, innovative workspace design, cleaning, break room, and more, making organizations everywhere say, oh, when they see how much more we can do. ODP Business Solutions.
So thinking about that, what qualifications or certifications should a cleaning company have before taking on this type of healthcare facility cleaning?
So I think there's a multi-step, response to that. You can become chest certified through AHE. There's the CHESIP training. AHE ISSA offers SIM certifications, but then there's things that you can even find online for free. You can go to the OSHA website. You can go to the EPA and learn about disinfectants. CDC has wonderful free training out there. And even companies like Clorox Pro and Diversey offer training, some at a fee and some for free, that will tell you about how to clean in a healthcare setting.
So are there any that are really overlooked that are critical that we need to pay attention
Absolutely.
to?
So, I mean, we're talking about being around not only germs, but potentially body fluids. So just having the OSHA bloodborne pathogen standard training, that's a requirement.
Hmm.
That's not a maybe you should have this. If you're handling medical waste or if you're cleaning where there may be a body fluid, your employees have to be OSHA trained. PPE training, I think, is also critical. We want to ensure that we're keeping our staff safe. So if they don't know how to use proper PPE, and I'll use measles as another example, measles is very, very light and will remain up in the air for up to 2 hours. So
Hmm.
first, if you're going in and you're cleaning a measles room immediately after the patient's left, all those particles are still in the air, and as soon as you're done, they're coming right back down onto the surface. But also, if you have a measles patient who's left and you don't have the proper PPE for that person who's cleaning, if they're not putting on the right respiratory protection, they can still get sick because if you're my age, your measles vaccine may not still be working.
Oh, don't say that.
It's true. So if you were born in the 60s or the 70s, they have proven that that vaccine was less effective than the ones that came later. I had a titer done at my last hospital, and I had zero protection and had to receive my MMR again. And then there are people who are at a higher susceptibility for other things through the measles. So it's
Great.
really important.
You've picked my year of birth. I need to think about that. So, Iris, thanks a lot for that.
You can get a titer through your doctor who will tell you whether or not
Yeah,
you are
I will
immune.
bring that up. I see my doctor in a month or two, so or maybe sooner now after we've talked. Iris, to you personally, thinking about this, what does qualified even really mean? Because here's the thing. A BSc, they have to have their first job, right? They get their first healthcare facility cleaning contract, or maybe someone's a facility worker, they work in house. They're gonna have their first cleaning time, their first opportunity to demonstrate their skills. What does it mean to be qualified?
You need to research. You need to really understand what healthcare cleaning means. You have to be able to, at least once a day, I receive a phone call from one of my accounts asking me, do you have a process for this? Do you know how to handle this? The Joint Commission, which is a regulatory agency over hospitals and large healthcare facilities, actually put into their standards last year that every aspect, including cleaning, has to be prepared for the next pandemic because it's not a matter of if, it's a matter of when. We got very lucky that COVID didn't last on services for very long, but that's not the only thing that's out there. Candida auris, which always freaks people out when I talk about it, is a fungus that is making its way across the Northeast into the South. It has a 40% mortality rate. So does that mean that somebody like you or me is going to get sick with it? Most likely not. So it's people who are usually elderly, immunocompromised, and in poor health. But that fungal infection is killing almost half of the patients that affect it. It's very difficult to clean. It's even harder to identify. And you need to make sure that when you have someone who's coming in and cleaning your facilities, especially if it's a long-term care facility, someplace that's treating the elderly, or someplace that has patients who have open wounds or are going to be receiving procedures, that your person knows exactly what that is and what the right products are to kill. Because a fungicide is not necessarily a regular germicide.
The policing of it. When you go in to clean a healthcare setting, there's who's checking credentials? Can you talk about that?
I don't know that anybody's checking credentials. And I think too often that we see facilities that are going to go with the lowest bidder, and that's not always the way to go. I understand savings, but I also understand as a former healthcare leader that readmissions and surgical site infections and hospital acquired infections or even healthcare acquired infections cost money. So I believe it was $40 billion last year was what the US paid out. Because if I go to the hospital and I catch something, everything that they have to do to treat me from that point on is not billed. That's now on the health card care because that was acquired through the hospital. And it's also it's a bad impression because those are all publicly reported. There are validation tools that I always encourage that people use, not only as us, but as them. So I like to do ATP testing. I do visual verification. I love fluorescence because it's a really good training measure as well as a validation that something's been cleaned. And I don't like using those tools as a gotcha. I like them being used as a collaboration between myself, the customer, and the housekeepers to ensure that we're doing what we're saying that we're doing. But even little things. So, not all disinfectants are created equally. And the most important thing to understand is when you're disinfecting, you have to do it properly and you have to do it for the right amount of time. So if you're using disinfectant A, that might have a 5-minute dwell time. If you're using disinfectant B, it might have a 10-minute dwell time. And if you're not allowing disinfectants to dwell on the surface enough to kill everything, then you're not doing it right. And the EPA and OSHA say that just because you come in with a broken leg doesn't mean that you don't have a staph infection that nobody checked you for when you came in. So we have to make sure that we're allowing these chemicals to dwell long enough to kill everything.
Now, Iris, you work for KBS,
Yes.
and your company focuses on healthcare.
So my company has made the investment in bringing in me as their healthcare subject matter expert. And we're currently working on growing our platform. We have a good amount of healthcare customers, but we're looking to get more.
Okay. So my question is, you have an employee, someone who's a cleaning professional, and they're good at what they do. To move them from cleaning a tax accountant office to a healthcare setting, how much time, can you talk about the investment and what building service contractors should look at to do it right?
That's a great question. So, I think there's a couple of answers to that. The first thing is I always tell healthcare housekeepers or environmental services workers that we don't get to have bad days, right? You don't get to come in and phone it in because when you decide that you're not going to put 100% in, you can hurt someone. So I think that when you're looking at who you're onboarding to clean a healthcare account, it's really important to have someone who's going to understand that what we're doing is a part of patient care. It's no different than anybody else who's treating patients. And that includes in a doctor's office. It's not just cleaning within the hospital, it's any place that we're doing that. And then the second thing, it's not just about training once, it's repetitive training. It's constantly going over dwell times, PPE, ensuring that we're acting safely because we come into contact with all kinds of different things. I believe in weekly trainings. We send out little weekly minders to everyone, recognizing the different things. And then we ask our employees to teach it back to us. So it's not just, here, I've shown you how to disinfect. Now I want you to train me the way that I trained you so that I understand that you understand. And it's even little things like making sure that staff knows to clean from the cleanest to the dirtiest and not the other way around so that you're not moving pathogens back and forth.
What you're talking about it sounds like a duty. Like if you're going to clean in a healthcare setting, it's a calling in a way. Maybe I'm being a little sappy there, but it's not your normal uh, hire someone, give them a broom and a mop and a vacuum and go to work. So that mindset, can you talk about you covered it a little bit, but the mindset it takes to do this day in and day out, like a doctor or a nurse. Is that really a comparison we could make there?
100%. And, I've always told my staff from the first day that they start working that they're important and what they do is important. And I don't think that that's just something to say to somebody. I think it's important that they believe that because it really is critical that we do things the right way every day, every time. And for me, it is a calling. I spent a good portion of my youth with two parents who had health issues. So I spent a very large amount of time in hospitals. And I can actually remember being about 13 or 14 years old and saying to my dad, I would never work in a hospital. And then at some point, it became important to me. And then the work that I do now and advocating for doing things the right way and the committees that I belong on, it does really reflect a passion for this business.
Yeah. I'm in Columbus, Ohio, Iris, and I've been in a lot of the hospitals here for different reasons. Sometimes visiting patients, friends. I've seen some scenarios that shouldn't be. What are we
As
going to do? What are we going to do about that?
So, ISSA has that new division of the Healthcare Services Institute, for which I am also a member. And I think that what we are trying to do as an organization, along with ISSA, is create standards that everyone follows to ensure patient safety. When I was in Chicago a couple of weeks ago, the first speaker for HSI was a MRSA survivor, somebody who had a really bad staph infection and almost died from it. And I think that we should start all of our conversations about the people who have been affected by a surface that wasn't properly disinfected and what that outcome can mean.
When you walk into a healthcare facility and you can see the dirt and the grime in the corner, I mean, that's a tell that we need help. So, Iris, great conversation. Thank you for what you do for the industry. Any final words of advice for those watching who may be thinking, you know what, after watching this, it's scary, but I'm going to get into this. What would you tell them?
I would tell them that there's so many resources out there that you can use to learn how to do this the right way, but there's no shortcuts. I was on a walkthrough a couple of weeks ago for a hospital that was putting out some new business. And I overheard two gentlemen who were walking behind me say, "Oh, this isn't so different. They just need people." And I swung around and said, "This is completely different. And that's not what this workplace needs. And forgive me for being passionate, but this is not for you."
Well, I'm sure they learned a lesson, and maybe every day, Iris, as you have these conversations, you're making a difference. So appreciate you, and we'll look forward to your next time on Straight Talk.
I appreciate it. Thank you so much for having me.